The health department in the Limpopo province has come under fire as well as public scrutiny. This follows the leaking of sensitive and confidential documents pertaining to the issuing of tenders. Now, these documents allegedly point out that the Department of Health issued coal tenders to 14 hospitals that do not have coal processing facilities in the province. Now, the non-profit organization that leaked this document maintains that the health department is guilty of corruption when it awarded these tenders to the hospitals that do not have coal processing facilities, yet they were part of that bidding process where they were allegedly awarded tenders. Now, the health department in the province maintains that that is false and that it was busy with an internal investigation into the matter. Joining us to talk further about these allegations is the spokesperson of the department in the province, Neil Shikwambana. Neil, thank you very much for joining us on SABC News. Looking at what these documents are detailing, that the department intentionally issued tenders to 14 hospitals for coal that do not have boilers or coal processing facilities. First of all, talk to us about these allegations.
Thank you for having us. Look, I think what we firstly need to clarify is that the sensitive internal documents which have been leaked to the media are basically part of the internal investigation that was going on. What happened is that after the winning companies who won this bid were given letters to say to them, you have won this bid to supply coal to hospital 1, 2, 3, 4. Then our authorities were then informed that part of those companies have been awarded to supply coal in hospitals which do not necessarily have boilers which utilizes coal. Now, what happened is that the MEC subsequently and immediately instructed the HOD to look into the matter. So there was correspondence that was exchanged between the executive in the department, HOD, CFO, Chief Director, and so just to find out exactly what happened. Now, these correspondences are what actually got leaked into the public, and we think it was done mischievously to undermine this process. But what we need to for people to understand is that it's absolutely not true to say that the department has actually engaged in a corrupt practice with these tenders, because what had happened is that when the MEC was alerted, or the authorities were alerted of this mishap, the companies had only been awarded the winning letters. They had not signed the contract or the service level agreement. That means they had not actually done the delivery. They had not actually there was no actually any order that was issued, and no payment was made. Also, that people need to take note of is that these tenders are on a need-based basis, in the sense that you don't just wake up every day and say you're delivering coal. Hospital B will call you and say, we've run out of coal. As a contractor that was appointed for us, can you deliver coal? So we get a sense that although we still need to understand why were those hospitals which are not currently utilizing coal were part of the specification, we get a sense that even if the contract would have gone on, I don't think it would have been possible for hospitals that do not use coal to order and also get paid.
All right, that mere fact which you are just pointing out to Mr. Shikwambane, that the hospitals without coal boilers were part of the tender specifications, does it also not point out to maybe any errors within your procurement system perhaps that might need to be looked to, or is it part of this ongoing investigation?
Certainly, it is part of our investigation, but I like your choice of words, because you're talking about an error. It could be that that is a possibility, because there are various scenarios that we can play around. For instance, we can we don't want to assume, but I just want to give this as an example to say it's possible that when specifications were developed, because also what we need to clarify is that it's not as if those hospitals do not have the coal processing facilities in the form of boilers. They do have boilers. But during the time when the tender was awarded, the boilers were not functioning. I think we need to get that one very clear. So there are a number of scenarios that we can play around to say probably, and we don't say this is what happened. It could be that when the specification was developed, the boilers were working, and when the tender was awarded, because there's a time lapse in between, the boiler was broken, or there could have been an oversight from people who develop specifications. So those are the kind of scenarios that form part of our investigation, because we don't take this matter lightly. We're taking it serious. Hence, we feel we don't need to assume, but we need to extensively investigate, get to the bottom of it, so that if there's anybody who is responsible, we can be able to act accordingly.